7% colon capsule versus computed tomography colonography for colorectal cancer screening in patients with positive fecal occult blood test who refuse colonoscopy, a randomized trial. Introduction. The current colorectal cancer (CRC) screening strategy in many countries is based on a fecal occult blood test (FOBT), yet participation is limited and varies from 7% to 67.7% between countries. In France, a mass screening program was launched in 2002, and the screening experience reached 42% in 2006. For patients with a positive FOBT, colonoscopy is recommended. However, between 7% and 48.5% of patients with positive FOBT do not undergo the recommended colonoscopy. In France, the rate of patients with positive FOBT, either guaiac FOBT, G-FOBT, or fecal immunochemical test, who refuse colonoscopy is 10%, despite a national reminder strategy. This includes a postal reminder sent to the family doctor at 3 months, and then to the patient at 6 months and 1 year. These reminders contain information about CRC screening and the risk of CRC following a positive FOBT result. When the patient does not reply to any letter or refuses to undergo the colonoscopy, no further action is taken. These patients are therefore lost to follow-up despite having a positive FOBT and a significant risk of CRC or adenoma. With a view to reducing the number of such patients, the aim of the current study was to evaluate the benefits of proposing a less invasive strategy than colonoscopy in order to recruit patients. The two options available were video capsule endoscopy, VCE, and computed tomography colonography, CTC. The latter is effective in detecting CRC and is recommended in France in cases of contraindication or refusal of standard colonoscopy. VCE is another option for CRC screening, and its superficial colonic lesion detection rate has been demonstrated to be superior to CTC. However, the additional participation that could be obtained by proposing these procedures to patients who are unwilling to undergo colonoscopy despite positive FOBT in a screening program is not known. Participation in a strategy that is less invasive than colonoscopy, but with high sensitivity or specificity, could improve patient selection by motivating otherwise reluctant patients to undergo colonoscopy if they have positive findings, but also avoid negative colonoscopy in patients without neoplastic findings on VCE or CTC. Therefore, the aim of this prospective randomized study was to compare VCE and CTC in terms of the additional participation obtained in patients with a positive GFOBT who did not undergo the further recommended colonoscopy. Objective: some patients, 10% to 32%, with a positive guaiac fecal occult blood test, GFOBT, do not undergo the recommended colonoscopy. The aim of this study was to compare video capsule endoscopy, VCE, and computed tomography colonography, CTC, in terms of participation rate and detection outcomes when offered to patients with a positive GFOBT who did not undergo the recommended colonoscopy. Methods: an invitation letter offering CTC or VCE was sent to selected patients after randomization. Acceptance of the proposed or alternative procedure and procedure results were recorded. Sample size was evaluated according to the hypothesis of a 13% increase of participation with VCE. Results: a total of 756 patients were targeted. Following the invitation letter, 5.0% of patients underwent the proposed VCE, 19 of 378, and 7.4%, 28 of 378, underwent CTC, p equals 0.18. Following the letter, 9.8% of patients, 37 of 378, in the VCE group underwent a diagnostic procedure, 19 VCE, 1 CTC, 17 colonoscopy, versus 10.8% in the CTC group, 41 of 378, 28 CTC, 13 colonoscopy, p equals 0.55. There were more potentially neoplastic lesions diagnosed in the VCE group than in the CTC group, 12 of 20, 60.0%, versus 8 of 28, 28.6%, p equals 0.04. Thus, 15 of 20 non-invasive procedures in the VCE group, 19 VCE, 1 CTC, 75.0%, versus 10 of 28 in the CTC group, 35.7%, p equals 0.01, resulted in a recommendation of further colonoscopy, but only 10 of 25 patients actually underwent this proposed colonoscopy. Conclusions: Patients with a positive GFOBT result who do not undergo the recommended colonoscopy are difficult to recruit to the screening program, and simply proposing an additional, less invasive procedure, such as VCE or CTC, is not an effective strategy.